How's everyone going? I'm often scheduled at the period after lunch. It's always a post-prandial period, I call it, and everyone's dozing off, but I'm catching you before lunch, so here we go. And thanks again for the invitation. What I'm going to cover this morning is to look back in time, firstly, before moving forward in time. It sounds a bit crazy, but in preparing a number of presentations in the past, I've been able to work with a historian who really taught me quite a lot about what you can actually take by looking at historical records and understand particularly urban form and how it can be played out and is being played out in our urban form of the 21st century. So I'm going to look at that. And then I'm just going to look at some unique techniques that the research lab that I'm working in are using to explore how might we better develop and build our urban form in the 21st century. And I then I've got a few action strategies. Probably there could be many, many more than what I've listed there. I typically run out of time, so we'll just see how I go with action strategies. Here's Melbourne in the 1800s. For those of you who haven't visited Melbourne, it sort of was one of the most wealthiest cities. I think it was the wealthiest city in the world in around 1850 with the gold rush period, and it had a huge population growth. And this is sort of one of the designs that we see of our large boulevards that we have in the main, thoroughfares of the CBD. And the literature at that time, the planning guidelines, really had quite a focus around the health implications of Melbourne. And it all, at the time, was related to the miasma theory, and I really probably don't need to explain what that is to this public health audience. But it was not the only city that was designing around the miasma theory, and the miasma theory ensured that you would have these huge thoroughfares so that the clean air could pass through quickly and dispel the polluted air where the potential transmissions of disease was occurring from. But it also gave some insights about the transport systems of the day as well, and these streets needed to be sufficiently large to ensure the horse and cart could turn in them as well. And I took from that even back in 200 years ago, there was an interaction between the urban systems and design. And we're beginning to relook at that in terms of our systems approach, and I think that's a really important point. But it was not only in cities like Melbourne that you can pick that up in the historical literature, as you can in Paris. And this is, I've mentioned as probably an illustration of placemaking, but that was probably more my ignorance than anything else in terms of the 1840s and 50s where they redesigned Paris. I don't think there was much community collaboration in that placemaking. What happened here was Napoleon Bonaparte came back from exile in London, had seen how the Brits were doing a great job of sanitation and sewerage systems, and actually wanted to replicate the same dingy, dark, squalid Paris, and spent the equivalent of $75 billion, today's money, in transforming Paris to the Paris we know today. They knocked down 12,000 buildings. They created the massive boulevards, again for the miasma theory concept, that the germ theory hadn't even occurred at that stage. But again, the urban systems were interacting. These large boulevards were not only just for the clean air to pass through, but they were also there for access, for transport, but importantly, access around governance so that the troops could control people coming in and out. So again, if you go back historically, you can see how our urban systems interact and play out some of it in terms of our health. Interesting fact, just the Paris is referred to as the City of Lights, and it was at that time in this sort of placemaking, this grand placemaking that Louis Bonaparte made or undertook, they installed the gas lights and across all streets, and that's the reason for why they call it the City of Lights. So it's just that I had in my long trip here a layover at LAX, and walking between Terminal 5 and Terminal 6, It's got a whole array of cities that you can look at as you walk down this thoroughfare. And it has Paris, the City of Lights. But it doesn't say the City of Lights come from the gas lights. It comes from it's something like great theatre and great culture. That's why it's called City of Lights. So I think it also points to another thing that I think is really important to understand, is that our evidence can be construed, and it's important to understand where it evolves from. So moving forward 200 years, we come to our 21st century cities, and how do we understand the implications of health implications in those cities? What we've been doing in our research lab at the University of Melbourne is, unfortunately, we're not supported by Bloomberg Associates and Bloomberg, and so we're using standard data, and actually we're using Google data. So like Quinn mentioned yesterday, we were able to get access to the Google data before they started charging for it. And so it's given us a unique opportunity to look at every city in the world. What we downloaded was Google static maps for every city with a population of 300,000 or more. And we were able to standardise each city's map that we looked at by just focusing on the areas that we're particularly interested in, which is cars and the road network and public transit, but also green space and blue space. And we randomly sampled every city. We were able to randomly select 1,000 images. Here's just two of them that you can see here for Paris. And these are the typical sort of images that we had for every city. Here, the orange line here represents the public transit. The black lines represent the road networks, and you can see in here the green and the blue space for each city. And that's as simple as we got for every city. We had 1,692 cities that we were able to look at. So one of the unique elements in the 21st century is access to this sort of data, the standardised data, that allows you to begin to look at comparing cities across the globe in terms of their health performance and in terms of their urban form. What we have used here is also very unique techniques in machine learning. For those who are interested in it, we've used convolutional neural networks, which has machine learning algorithms that focus on image processing. One of the other elements when you're using convolutional neural networks too is that you can also use a graph analysis to allow you to look at the spatial distribution of cities. And what we're doing in this convolutional neural network is actually congregating, in essence. It's almost like an old-fashioned cluster analysis that we used to do, or even factor analysis years ago. What it's doing is grouping cities alike based on the key set criteria that I indicated, the road networks, the green space and blue space. So basically what this is saying is that there were 9 sort of city typologies of those 1,692 cities that we were looking at. And a city that fell, say, here in, let's say, typology 5, would never be misclassified in cluster 4, which is over this side of the spatial distribution. So these cities here are very unlike each other based on the criteria that I just mentioned. Now, what this has done, this sort of analysis, for the first time we've been able to identify a type of city typology. And what we then did is we've identified here 9 city typologies. And we actually got a select grouping of urban professionals, urban planners, architects, designers, engineers, to assist with the classifications that we were seeing. And these are the sort of, you probably can't read it that clearly here, but these are the definitions we've got for each of these clusters. But you can see that some of the clusters here, for example, cluster 6 is called motor cities. They're medium to low density, high capacity, grid-based networks, medium rail transit. Now, I've looked at this analysis for cities in the region I live in Asia Pacific, and we had about 800 cities that fell into the Asia Pacific region. And you can see here that the majority of cities in Asia and Pacific fall into what we call cluster 2, the irregular cluster, which are high green space, mixed formal and informal infrastructure, few high-capacity road networks, and limited mass transit. And so it gives you some insights around the types of cities we're dealing with based on this unique approach. And another way of looking at it is at a country level, and this is a pretty messy messy figure here, and I'm just going to break it and chop it into sections so it's palatable. But what it's doing here is taking countries and just showing what sort of distributions of city typologies there are in each country. So if I just look at these two here, again, they're focused around Asia and Pacific. But you can see here that the city typologies, there's almost no variation in city typologies for these cities here, such as Sweden, Norway, Ireland, Denmark. And there's, interestingly, I think there was two, not in this one, but there was two Asia-Pacific countries, Japan and Singapore, that fell into this criteria. And these are high transit focused cities, so they've obviously got a great deal of infrastructure around high transit. But you can see in some of these other areas here very mixed modes or city typologies, such as China, where you see massive differences between, say, the east coast of China and the west. I'm running out of time. This is, again, much clearer. So what we then did was, okay, so that's unique information and it's giving us some insights around city typologies. What we wanted to know is, do those city typologies influence our health outcomes? And again, this is a challenging area because we've got city-based data and we wanted to overlay city health metrics, and we can't do it for every city. What we used here is the global burden of disease data, and all of you would know here that that's country-based and it's not city-based. So we've developed some techniques to look at how do we weight country-based global burden of disease data and look at it at a city level. It's not robust, but the outcome we've been able to look at in this instance was road traffic injury, and this is just an example of what we see in relation to road traffic injury based on those city typologies. And I'm just doing it. Whoops, I'll just go back. Doing it very quickly. What it's highlighting here is that there is, based on these city cluster types, if we look at what we see in terms of road trauma, there's some sort of trend occurring here. But you can also see here in terms of our vulnerable road users, like our pedestrians or our cyclists, there's not huge variation in these areas here in terms of these clusters, in terms of our death. This is disability-adjusted life years. But what you can see from some of this is that there are some unique performances based on types of clusters. What we're seeing here, cluster 8, for example, we're seeing reasonable metrics in terms of the vulnerable road users and also lower levels of road trauma here. And that intense city cluster is one where there's high density, so we're looking at compact type cities. There's cities that have great investment in transit, in public transit, and they've also got great investment in green space. So it's telling us something straight away, just by looking at one of the health outcome measures in terms of road trauma, that some of these city typologies are giving us some understanding around how might we better design our cities, or begin to understand around compactness, the green space. What we're looking at next is looking at satellite imagery and remote sensing for air pollution to look at this as well using these techniques. I'm running out of time, so I can't give you this one, but it's another illustration where we're actually using, again, machine learning, but different type of machine learning. This is generative adversarial networks. And we're actually looking at images. We've downloaded Google Street View images, again, globally. And what we're doing here is transferring it from, we've got overlay of our population health data for Victoria, the state of Victoria, Melbourne's the capital of, and we're looking at areas that have got good self-reported health metrics around good social capital, and looking at it and comparing it to areas that are poor, have poor self-reported health, and then looking at how do you change the urban form from good to bad and vice versa. And this is just an illustration here that what it was showing is those with good, positive health-reported outcomes had much greener environments. And if you were to make it a poor area, it actually strips the greenery out of it. And this third picture here is really just showing what's the difference between the original picture and the developed picture or translated picture. It's showing that trees are reduced in height, greenery is removed. So it's starting to give us some real insights around our urban form and how we might transform that. So to the last point then is action strategies to improve health. I'm really racing through some of the ideas that we're looking at. But the most important point I think here is that we are taking a lot of what we've learned from the past and using that to guide what direction we should be going in, not only in terms of our research, but in terms of what policy implications. What we're seeing from that large machine learning piece, where we've been able to look at and contrast cities globally, is that, you know, our urban form, particularly in the 20th century, has been totally influenced by cars. And we've heard that today and yesterday as well. And that is influencing and having major health implications. And those are the sort of things we need to begin to really place considerable focus on in terms of designing our urban form. Application to standardised data, we've heard over the last few days. I've got to finish up. So, and the other point I wanted to highlight, which has been well articulated over the last 2 days as well, is this idea around transdisciplinary integration. And really, Anita's presentation was highlighting again how important that is, that we look at health and well-being across the board and across all of the systems if we're going to achieve healthy urban environments. Thank you.